Okay, today we're going to be talking about complete bed bath. This is the M&A skill that we're focusing on at this time. We've just finished our lecture in our grooming and hygiene chapters, and so today we want to focus on complete bed bath. There are a few things that I want you to focus on while you're reviewing this video, and once this video is completed, I will be uploading it to Schoology, and you will have access to it at any time should you need to. The four things that I want you to focus on are residents' rights, how are those exercised during this skill, infection control practices, how do we make sure that infection control is being maintained, patient safety, what exercises do we do to make sure that our patients stay safe during these types of procedures, and also just the procedure itself are things that I want you to focus on. Now, once we have completed the video and you have reviewed it, I will be doing an exercise to see if you can point out some examples of those four main objectives for the complete bed bath skill. So, as with every skill, we want to begin with complete bed bath is a skill that requires a lot of dignity for your patient. It's also to maintain quality for their life. A lot of your patients, some of them may not be able to get out of bed for different and various reasons, and we talked about that in our lecture. And so sometimes it does come to the point where you do have to do a bed bath for your patient. We want to make sure we're meeting their comfort and hygiene needs, and we can do that successfully by giving them a good, complete bed bath. So that's what we want to focus on today. The first thing you want to do is make sure you have all of your equipment for your procedure. And I have all of those assembled right over here. You're going to need at least 3 towels, a bath blanket to keep your patient nice and warm and comfortable, a new clean gown to put on your patient after the procedure has been completed, a soiled utility barrel to put in your dirty linens as you're completing the procedure for your patient. You need 2 bath basins, the standard bath basin. I used 2 during this procedure, and I put in 7 washcloths to each of my basins. Also, soap. A nice little pan or a third basin would work as well, because we want to allow our patients to have hand and foot soaks during this bed bath as well. Also, you want to make sure you have your patients deodorant and any lotion that they may use of their choice, so that we can provide those once we have completed the bed bath itself. Gloves. This does not require gloves unless you feel like you need to wear gloves. The only part of this skill where gloves are required is during the perineal care section. So that's when you would want to make sure you have your gloves available. So, once you've got all of your equipment assembled, and this is also on your task list procedure checklist as well, you can review that. You just want to simply start from the beginning of your procedure. And as with every procedure, you simply just knock. Good morning, Miss Smith. My name is Jennifer, and I'm going to be assisting you with a bed bath this morning. I understand that you're not able to get out of bed today, and that's completely okay. And that you're requesting to be freshened up a little bit, which I can completely understand. So we can do all that right here in the comfort of your bed, and you don't have to get up for anything. So I'm going to shut your door to provide you some privacy. Pull your curtain, and I've got all of my equipment right here ready to roll. And we'll get this started. And so you want to make sure you do hand hygiene before every procedure. And at this point, you want to raise your side rail. Get your side rail up, and you want to raise your bed to a comfortable working position. Now, before I do all of this, I want to make sure that I have my water here and available. And we can verbalize this. Unless you would prefer to use actual water during your skills practice, that's completely fine as well. But for time constraints, we're just going to pretend that we have our water here and available. So each pail has nice warm water available in it. So now that I've got my rail up, I'm going to raise my bed. to a comfortable working position for me. I'm going to let my bed rail down so that I'm not working over it. I'm going to simply lay my operating device over there as well. And I would also lower that rail as well. So first thing I'm going to do, provide my patient with a bath blanket. This is for privacy as well as comfort for your patient to make sure they're not getting cold during the procedure. I'm going to pull your blankets down so that I don't get them wet. Now this is at the point where you would want to ask your patient, would you like me to take your pillows or would you like to keep your pillows? This patient has elected to keep her pillows. Sometimes they do like to keep their pillows because it hurts their neck to take them. So at this point, I'm just going to loosen the gown. I'm not going to take it off just yet. Just going to simply loosen the gown. And just maybe slide it off the arms. Being careful not to expose your patient. Take a towel and we can simply lay it across the chest at this point. Now, Mrs. Jones, would you like to have soap on your face? No? Okay. So I have my equipment here. I'm going to take my first washcloth, wring it out over my basin. I'm going to make a mitt, simple mitt. Wrap it around your hand. I'm going to tuck the mitt. And you're going to wash your patient's eyes, starting at the middle, and working your way out the far eye. Change the spot on your washcloth, work the way out to this. And you may have to do this a couple of times, especially if it's first thing in the morning, your patient's waking up, they may have some crusties and things of that nature going on. Then you can simply get rid of that washcloth, put it in your soiled utility barrel. Get your additional washcloths that you have there, wring that water out as well. And this is where you would simply just starting to wash your patient's face. Again with your mitt. And you just wash their face, get behind the ears, changing the spot on your washcloth several times throughout the procedure. Get behind your ears, get the neck really well. And again, this patient elected not to have soap used, so there is no cause for rinsing. So once we feel like that's nice and wiped off, we're going to get rid of our washcloth. We're going to take our towel and we can pat them dry. Okay. We've got our towel here. At this point, we can start with the chest if we choose to. And at this point, I'm actually going to remove her gown. And remember, it's another reason why we have our bath blanket on. Roll that up in a nice ball. Get rid of that in your soiled utility barrel. So at this point, I can either start with the chest or I can go for the arm. If I'm going to go for the arm, I'm going to take a towel. And we want to clean this side first. We don't want to work over our clean side. So we don't want to clean this first and then be leaning over it and working over it. So I'm going to simply take a towel because I want to save my bed. And I'm going to put her arm underneath my towel. And we're going to get this started. You're doing okay, Mrs. Jones? So I get my washcloth, wring it out, make my mitt, get me some soap, rub that in, starting at the hand. And at this point, I also have a little tub of water here. Mrs. Smith could be soaking her hand at this point, if she's able to do so. And it feels really, really good on their hands. I'm going to let that soak for a few minutes. I'm going to take my basin back out. Then I'm just going to be washing up the arm, saving my armpit for last, axillary area. Going to get rid of that washcloth. Going to get my rinse cloth, wring it out, and then I'm going to rinse. Same thing, rinsing. She's all nice and rinsed. Get rid of that washcloth. Now I'm going to dry. Take my towel that I'm using. I'm going to dry. Make sure you dry between the fingers and the axillary area very well. Dark, moist places are great environments for yeast and things of that nature to start to develop, and we don't want to cause any excoriation in your patient's underarms. And so you want to make sure you dry that very well. So once we're finished with that, we're going to take our towel, cover her back up, do the same thing for this arm. Set your towel to side, and this is where we could start on the patient's chest. Again, getting your washcloth, wringing it out, making your mitten, getting your soap, and while shielding your patient, you would wash their chest area. For females, you want to make sure you get under the breast area very well. Wash it. Just like with your arms, rinse it with your washcloth after you've wrung out the excess water. Rinse in the same fashion. And dry that as well. And you move down into sections, simply folding your towel up, bringing your bath blanket down, doing the abdominal area in the same way, moving down just above your patient's pubic area, getting all of that area clean, rinsing, drying, and things of that nature. Once you have finished that portion, you want to cover your patient up. You can remove this towel, lay it to the side. At this point, you want to check the temperature of your water. It could start to get cool. So if that were the case, simply raise your side rail, put your bed down, go change your water, come back, and wash your hands, and we're going to get started again. So you put your rail back down, raise your bed up again for a comfortable working position, and we would simply come down here and start working on the legs. Same fashion. Expose the far leg. Put your towel underneath your leg, just like you did with the arms. If your patients were able to, at this point, you could allow them to soak their foot. You want to make sure when you are washing, you've got your rag to wash, got your soap. You get in between the toes very well, because those are nice areas for things to accumulate, and they tend to stick around there. Working your way up your leg to the thigh area. holding and supporting your patient's leg with your hand underneath the knee, not allowing it to dangle or anything of that nature. So you're going to wash. And again, rinse. This is not a hard procedure, it's just a time-consuming procedure, but one that provides great comfort to your patients all at the same time. And it gives them some social interaction as well, which they really, really appreciate. Going to get rid of that rag. You're going to dry. You're going to take that towel, put it to the side, cover that leg. Do the same thing for this leg. At this point, you may want to check the temperature of your water. This is cause for a water change at this time as well. Same procedure. Lift up your rail. Lower your bed. Make sure your patient has the call light while you're not right there at the bedside. Change your water if you need to. Come back. Wash your hands again. Put your rail down. Put your bed back up. Now we're ready to roll your patient onto their side so that we can do the back and backside areas. So, due to time constraints, we won't do that, but I will talk you through those steps. You would simply, on the count of 3, log roll your patient onto the side away from you. While your patient is over on their side, simply take your towel long ways, lay it right up against their back, starting at their shoulders, working your way down their back, washing, rinsing, and those types of things. Once you have dried your patient's back, this is a great opportunity to give them a back rub. You want to start up the spine and work your way down in circles. Again, you're going to go up the spine, working your way down in circles. This is a great opportunity to put lotion on their back as well. They really, really enjoy that. So once you've got that all finished, you want to take that opportunity and we're going to roll our patient back over. Take your towel, set it to the side, help your patient back onto their back, and at this point we can start with our perineal care. Do your perineal care just like you have been taught in a previous skill. We're going to make sure that we're cleaning from front to back to avoid the possibility of introducing dirty surfaces to clean surfaces. So we want to make sure that we're doing that as well. At that point, your patient's bed bath is complete. You can get rid of any of the dirty linen that you have by putting that in your soiled utility basket that you may have. At this point, you can offer your patient, would you like for me to put lotion on your arms and your legs? This is also the opportunity where you want to make sure you apply your patient's deodorant as well. And then the final thing you want to provide for your patient is a nice, clean gown. So we want to make sure we put our gown on our patient without exposing them again. Doing this side, and once we've got our gown on our patient, you always want to tie the ties of your gown to the side and never right directly on the back of the neck. You don't want your patient to lie on that because that can cause skin issues as well. So we're going to tie this to the side. Get rid of your bath blanket at this point. You no longer need it. So we can roll that away in a ball. At this point, we can cover our patient back up. Unless that is necessary that they have a linen change, we can do that as well. So at this point, we're ready to make sure our patient's nice and comfortable. We want to lift up our rail. We want to put our bed back down. Offer to lift your patient's head just so slightly so they're not lying on a flat surface. Make sure their call light is within their reach. Put your red bed rails back down on both sides, unless your care plan indicates that they need side rails. Make sure you get rid of all of your equipment back to where your patient had it before, had it stowed, and make sure your patient's equipment goes back in their drawer. You want to wash your hands. Thank the patient for their cooperation. Ask them if they have any issues, if there's anything that you need to let your charge nurse be aware of. If they've complained of anything, if you noticed any skin breakdown or skin issues, those are also things you want to report to your charge nurse. Now this concludes the procedure for complete bed bath.